Good afternoon, everyone. Welcome back. Thank you for joining us. We're glad that you're here. I'm Steve,
And I'm Scott.
and together we are Backyard Musings, the Science and Technology channel.
Yeah, and we are talking about an interesting one today. Hopefully, we've all heard of the bird flu and how dangerous it can be. And this is kind of an interesting little little help in that situation. So, who would have thought?
Scott, before we jump in, I just want to mention I remember H1N1, the very first one, because I was in Afghanistan and they were checking at the to get on the plane to come back home for leave. They were checking if you didn't make your temperature, they wouldn't let you on the plane. The army wouldn't.
Is
And
that the
so
only? Was that the only thing they were judging? Was just your temperature?
temperature, yeah.
Wow.
And they didn't want you bringing it back to the States. And the day before, I went to an Afghani bazaar on our post. They had like a food court, if that's what you could call it. And a captain buddy of mine suggested we go over there. And we went over there, and there was this plate. They had the meat. They had they were kebab type things. They had a handkerchief or whatever over it, and it was covered with flies. And I was like, "Oh, that looks sus." But I ate it, and man, I was throwing up, had fever. I was afraid I wouldn't be able to get on that flight, but I got on.
So obviously, did you have any other issues besides?
Well, diarrhea, diarrhea.
Well, of course.
It was food poisoning.
You passed the temperature
Yeah.
test, but you didn't pass the digestive test. Wow,
No.
interesting.
So check this out. A new nasal spray vaccine could stop bird flu at the door, blocking infection, reducing spread, and helping head off the next pandemic. Sounds like a winner.
Yeah.
Since first appearing in the United States in 2014, H5N1 avian influenza, widely known as bird flu, has steadily expanded its reach. The virus has spread from wild birds into farm animals and more recently to humans. Since 2022, more than 70 people in the U.S. have been infected, including 2 deaths. Because the virus continues to circulate widely among animals, scientists warn that it has ongoing opportunities to adapt in ways that could allow it to spread more easily between people, raising fears of a future pandemic. The findings were published January 30th in 2026 in Cell Reports Medicine. Would you like to know more?
Huh. To reduce that risk, researchers at Washington University School of Medicine in St. Louis developed a nasal spray vaccine aimed at stopping the virus at its point of entry. When tested in hamsters and mice, the vaccine triggered some strong immune responses and successfully prevented infection after exposure to H5N1. One major concern with bird flu vaccines is that immunity from previous seasonal flu infections or vaccinations could weaken their effectiveness. The research team addressed this issue directly and found that their nasal vaccine remained highly protective even in animals with prior flu immunity.
Okay, I got a question here. They tested it on birds and or on mice, right?
And
How did they get a nasal spray nozzle thing small enough to fit into the nostrils of a mouse?
hey, they could do it. You get a little tiny mouse-sized tube and stick it up there, I guess. So,
I don't know. I don't know.
do we have any idea? And I don't know if we're going to talk about it, but do we have any idea what birds carry the bird flu? I mean, what about waterfowl that people hunt and eat, or upland game birds that hunt?
That's a
People
good
hunt.
question. I mean, the flu we don't call it the human flu because it goes around all the humans. So I wonder if it travels around all the birds, the bird flu.
Yeah, I don't know. Maybe cooking the meat, the poultry. Not poultry. That would be chickens, right?
The fowl.
Fowl in the earth, right? The fowl and yeah, maybe cooking it kind of kills the virus. So if they have it, I don't know. Maybe they don't have it. So anyway, here we go.
Here's a quote. This particular version of bird flu has been around for some time, but the unique and totally unexpected event where it jumped across species into dairy cows in the United States was a clear sign that we should prepare for the event that a pandemic may occur, said Jocko Boone, PhD. Not making that up. Jacco, Jocko, a professor in the WashU Medicine, John T. Millikan Department of Science, and co-senior author of the study.
Okay. Quote, our vaccine to the nose and upper airway, not the shot in the arm vaccine people are used to, can protect against upper respiratory infection as well as severe disease. This could provide better protection against transmission because it protects against infection in the first place, unquote.
While a bird flu vaccine already exists, it was designed using older strains of the virus and may not work well against current variants and is not widely available. To develop a more effective option, Boone and his colleagues built on nasal vaccine technology previously created at WashU Medicine by co-authors Michael S. Diamond, medical doctor, PhD, and David T. Curiel, medical doctor, PhD, a professor of radiation oncology. A COVID-19 vaccine based on this same platform has been used in India since 2022 and received approval for clinical testing in the United States last year.
Effective vaccines depend on the immune system's ability to recognize a virus quickly and accurately. For the H5N1 vaccine, Boone and co-author Eva Maria Strach, PhD and associate professor of medicine specializing in antivirals and protein design, selected proteins from the strains of bird flu that have been infected humans or that have infected humans. Using shared features from these viral proteins, they engineered an optimized antigen, the part of the virus that triggers an immune response. This antigen was then placed into a harmless, non-replicating adenovirus, okay, which serves as the delivery vehicle for the vaccine. The overall design closely resembles the team's COVID-19 nasal vaccine approach. I don't ever remember a nasal vaccine for COVID, but maybe so.
Well, India was using it. It wasn't approved here.
Oh, okay. Gotcha.
In laboratory testing, the nasal vaccine provided near complete protection against H5N1 protection in both hamsters and mice using those small nasal sprays that Scott mentioned.
Yep.
As expected, standard seasonal flu vaccines offered little defense against bird flu. The nasal spray consistently outperformed the same vaccine formula given as a traditional injection. Researchers also observed strong protection even when animals received a low vaccine dose and were exposed to high levels of the virus.
Delivering the vaccine through the nose produced broad immune responses throughout the body, with especially strong activity in the nasal passages and respiratory tract. According to Boone, this method offers a major advantage over intramuscular shots by providing better protection in the nose and lungs. Probably gets to the root of the cause quicker, right?
Yeah.
Which likely reduces both severe illness and the risk of transmission. Quote, we've shown that this nasal vaccine delivery platform we've conceived, designed, and conducted initial testing on at WashU Medicine can prevent H5N1 infection from taking hold in the nose and lungs.
Of mice.
Yeah, they didn't put that in there. How come? Interesting. That's according to Dr. Diamond. I think they're doctor. The study's co-senior author. Quote again, delivering vaccine directly to the upper airway, where you most need protection from respiratory infection, could disrupt the cycle of infection and transmission. That's crucial to slowing the spread of infection for the H5N1, as well as other flu strains and respiratory infections, unquote.
The researchers also tested whether immunity from previous flu vaccinations or infections would interfere with the new vaccine's performance. The results showed that the nasal vaccine remained highly effective even in the presence of existing flu immunity. This is an important finding since most people, aside from very young children, already have immune memory from past influenza exposure.
Next, the team plans to conduct additional animal studies and experiments using organoids that mimic human immune tissue. They also aim to refine future versions of the vaccine to further reduce any influence from past seasonal flu exposure while enhancing antiviral responses. Okay, I'm not familiar with this organoids, but it sounds like it's a model of human tissue,
Yeah,
not actually human tissue. So
right.
why didn't they just go right to that to begin with?
Because it doesn't have lungs.
I don't know, but you'd think that they would go to that rather than dealing with the mice and the hamsters. But anyway, what do I know? Anyway, good story. So I'm a nasal spray guy, so I think that this would be a lot of people I know don't like to push stuff up their nose, but it's helped me a lot. So I
But
would
you do
definitely use this. Definitely use
you
this.
do like to push stuff up your nose.
Maybe that's not exactly the best way to put it, but anyway, I would I would use this. I would try this if it
I'd
was
try it too.
yeah,
I mean, give
if
it to the
came down
VA
to
and have them inject us.
yeah. Yeah, I'd rather do that than take a shot. So
All right, folks. Thanks for joining us. Catch you in the morning.
take care, everyone. Good story.